Hi, my name is Triya and I'm a doctor working in London. Earlier this year I graduated from Oxford Medical School. Today I'm going to talk to you about the top 10 tips for surviving medical school. So tip 1 is to find out how you revise best and then stick to it. In medical school you'll have lots of exams and in different formats. So in Oxford you have essay questions and multiple choice papers, and then in clinical school you'll have exams called OSCEs, which are practical exams that you have to talk to or examine a patient. So because you have so many exams, it's really good to find out early on how you revise best and then keep doing that. So for me, I'm really not a morning person, so I revise best in the evenings. So my second tip is to start using question banks early. If you look online, you'll find lots of different question banks which have clinical questions that are designed for medical students. And now a lot of these have paid subscriptions, and I do think that they are worth it. Sometimes if you're lucky, you can get your medical school to pay for them as well. I think these question banks are more useful in clinical school, but I don't see the harm in starting them early. So in Oxford, your clinical years are your 4th, 5th and 6th years. So in my first exam in 4th year, I didn't use these question banks and relied on flashcards and written notes, but I found that actually I didn't do that well because clinical school is about the application of your knowledge, and a lot of the questions will be about clinical case scenarios and what to do. I then found that when I started using question banks, my exam results got a lot better. So my third tip is a really important one, and that is to give yourself a break. So the problem with medicine is that there's no limit to how much you can learn. Although most medical schools will give you a syllabus year on year, these are often considered a guideline of things that you should know. And for this reason, I think it's really important to know your own limit when it comes to revising and give yourself days off. Most medical courses are 5 or 6 years long, so it's really important to consider medical schools a marathon and not a sprint. I think it is really important to set good boundaries when it comes to studying, because studying is something that you unfortunately are going to have to do even after you graduate from medical school, because there are a lot of postgraduate exams that we have to do. My fourth tip follows on from the last one, and it's that you should try not to care so much about your grades. Now this one is definitely easier said than done, and it's something that I've had to work on throughout the last 6 years. I think because you have so many exams at medical school, it can get quite disheartening if you get a grade that you weren't expecting, especially given how much you worked for it. And also medical schools often rank students and publish these rankings, which means that often your self-worth is tied to your academic performance. I think a good way to think about it is that even if you're in the bottom decile of your year, when you graduate medical school, you'll still be a doctor. Being a doctor is more than just getting good grades. It's also about how you apply that knowledge in a clinical setting, and it's about being able to examine patients and talk to them with kindness and empathy. So really, when you have pass or fail exams in medical school, it is just about passing the exam. My fifth tip is that no matter how hard medical school gets, don't give up your hobbies. There's often lots of opportunities to try new things in medical school, and I think you should definitely take these up. Often medics have their own societies, such as medic badminton or medic choir. So I think this is really important because it reflects how your life will be once you're a doctor. Things will still be just as busy or even busier. So it's really important to be able to focus on things that are not just work. So tip 6 is to make sure you carry a pen and paper with you when you're on the ward. So clinical school, which in Oxford is the 4th, 5th and 6th years, is mainly set in the hospital. So the way it works is you'll spend a few weeks rotating between different wards in medicine and surgery, and you'll mainly learn your medicine by observing and doing things in a clinical setting. This is really useful for jotting things down that you see, for example, a disease or a clinical sign. So this is especially important if someone senior tells you to look something up, because chances are they will ask you about it the next time they see you, and it often is really useful for your learning too. So tip 7 is self-care. So being on the wards can actually be quite physically strenuous. You're often there for many hours and you're standing up for long periods of time. So I recommend carrying a water bottle and snacks and taking that with you in a bag. Often wards will have a doctor's room or an office where you can safely keep your bags. So I'd recommend on the first day of your placement, maybe get there a few minutes early so that you can identify where is the best place that you can keep your bag, and also where are the good toilets nearby and where can you get food. I also remember a doctor that I was shadowing once told me that as a medical student and as a doctor, whenever you see a free chair, you should just sit down, because you never know when you're next going to get a rest. So you should really make your own self-care and self-preservation your biggest priority. So tip 8 is to stay as long as you feel useful. So in clinical school, you'll have to balance your time between spending time on the wards and doing your own personal study. So when you're a medical student, it can be quite difficult to figure out when you should leave, because in the hospital, there'll always be something going on. So I think you shouldn't just hang around on the ward for the sake of it, but you should stay as long as it's useful. For example, once the ward round ends, you could then help out with a few jobs and decide to examine a few patients. And then once you've done these, you can just excuse yourself and go. Obviously, if a consultant says you should stay, then you should listen to them. One thing that is useful is to give yourself a goal for every day that you're on the wards. For example, your personal goal could be to examine 2 patients a day. So once you've done this, you could then leave. I think this is quite a difficult balance and something that you get better at as you go on, because you'll find the closer you get to exams, the more you'll need to actually do your own studies at home. So tip 9 is to introduce yourself to everyone on the team and to try to learn their names. So when I say team, I don't just mean the doctors, I also mean the nurses and the healthcare assistants and other people that are there. I think this is really important, even if your placement is only a few weeks long, because that way you'll feel more included and part of the team. I think often the problem with being on the ward as a medical student is that the doctors and the other team members are really busy and often don't have time to teach you. And I think that this does happen quite often and it is quite hard, but if you try to establish a good rapport with the team, it may be easier to then be included. So my last tip is that if someone gives you the opportunity to try out something, for example, this could be putting in a cannula or a catheter, then you should take it. So I think this tip is especially important if you're introverted like me and grabbing opportunities doesn't necessarily come naturally. For example, during my shadowing in A&E once, one of the junior doctors asked me if I wanted to try doing an ABG, which is an arterial blood gas. And this is something that I had tried out in a clinical skills lab before and I technically knew how to do. But I said no because I wasn't confident, but this doctor was quite keen for me to try and push me to do it. And it was really good because actually I did manage to do it. And if he hadn't pushed me, I would never have had that experience. But wards are really busy environments and not all doctors will have the time or the patience to encourage you to do something if you hesitate. So my advice would be to say yes and try. Obviously, if the doctor is there to supervise and guide you and the patient is happy for you to try as well. So those are all my tips. Thank you so much for watching the video. I hope this was useful. If you have any questions, let me know. Bye.